Welcome to our presentation on arthritis by Mohsin Beg, Pauline Chang, and Eliseo Kaimi.
Arthritis is characterized as a form of disease which causes stiffness in an individual's joints, resulting in pain and inflammation within the joint region. This may also result in the inability to freely move the joint affected. Arthritis tends to affect multiple joints in the body, causing a great deal of restriction in the movement of the body as a whole. There are many forms of arthritis an individual can experience, with symptoms ranging from pain, stiffness, swelling, redness, and decreased range of motion overall. The first type, which also happens to be the most common form of arthritis, is known as degenerative osteoarthritis. This occurs when the cartilage within the bone, which is responsible for cushioning impacts and assisting smooth movements, starts to wear away. Osteoarthritis tends to predominantly affect people of older ages as joints tend to wear out and become weak with age. Osteoarthritis mainly induces joint pain and stiffness of the joint itself, causing restrictive range of motion for the individual. Joints such as the wrist, knees, hips, and spine tend to be more commonly associated with osteoarthritis. Depending on the level of degeneration and the location of the joint, the patient may experience different ranges in severity with respect to the symptoms of osteoarthritis. Inflammatory arthritis is another type of arthritis which refers to the body's own immune system attacking the joint membrane cells. The immune system has the potential to degrade the structure of the joint due to excessive inflammation around the joint area. Rheumatoid arthritis is a very common example of this type of arthritis. Its degrading effects on a joint can range from moderate to severe, as well as involve other complications such as lesions occurring within the joint. As the precise etiology of rheumatoid arthritis is unknown, a specific virus or gene cannot be held responsible. This form of arthritis tends to result in painful swelling, prolonged inflammation, and restrictive movement of the joint. Joints within the hands and wrists tend to be the most susceptible to the effects of this form of arthritis. However, it can definitely affect a multitude of different joints within the body. Infectious arthritis can be acquired via a pathogen such as a bacterium, virus, or fungi. The presence of a pathogen within the body may induce inflammation within various joints. Causes of infectious arthritis can range from foodborne illnesses to sexually transmitted infections. This type of arthritis does have the possibility of inducing chronic effects upon the individual. However, in most cases, antibiotics can easily treat the condition successfully. Metabolic arthritis, or gout, is caused by the buildup of excessive uric acid within the body. Uric acid tends to form crystals within the bloodstream, and these sharp crystals can cause significant damage to the joint tissue, resulting in overall degradation of the joint. As this form of arthritis relies on the level of uric acid present within the body, symptoms of arthritis may change in severity in correlation with uric acid levels within the blood. Gout tends to primarily affect the joints of the big toe first, resulting in a drastic change in an individual's walking ability. There are many factors which may have an impact on the type of arthritis an individual may experience. These factors include age, gender, genetic factors, body weight, level of strain exerted upon the body, existing health conditions, lifestyle choices, and environmental factors. A great example can be seen in individuals with high consumption of red meat having a higher likelihood of suffering from gout due to increased levels of uric acid produced during the meat digestion process. Age plays a significant role in arthritis as joints start to suffer from cartilage deterioration with time, thus explaining the correlation of higher rates of arthritis associated with older age. Arthritis can be complex in various ways to the individual experiencing symptoms. Joint deterioration leads to restrictive movement in the joint, causing diminished ability of movement in the body. This may make tasks such as picking something up off the ground or getting up from a sitting position extremely difficult. If the movement of the body is impacted, then the individual suffering from arthritis will see the symptoms affecting their everyday activities, thus causing a decrease in overall quality of life.
We will begin with arthritis as a chronic disease.
As we all know, a chronic disease is defined by several characteristics. Characteristics of an individual with a chronic disease are long-term diseases that develop gradually over time, progress in severity, can often be controlled but hardly ever cured, may significantly impair everyday physical and mental abilities, reduce one's ability to accomplish activities of daily living, and affecting one's quality of life. Arthritis is a chronic condition in which the bones and joints tend to wear down due to everyday wear and tear use. Arthritis is a fluctuating and chronic disease which starts out with joint pain, fatigue, stiffness, and joint destruction, and can ultimately lead to functional disability. Arthritis poses a significant burden on one's everyday life and activities. It affects their self-identity and relationships with their family and friends. In a recent study conducted in 2011, analysis showed that arthritis severely impacted several aspects of participants' life. The participants' physical functions were harshly affected by their chronic arthritis. They described their symptoms and they included pain, fatigue, and joint stiffness. These symptoms had consequential effects on their everyday life and diminished their self-identity and perception of self. The participants described their adjustment to the physical restrictions as a fight between their mind and their body. Some had to create new routines to find new ways to perform their daily living activities in order to feel independent, although they were suffering with this disease. However, some of the participants defied that they had the disease and resented it. They didn't address their symptoms even though they knew what the possible consequences of ignoring treatment would be. It is hard for some to come to terms with arthritis because they know of its chronic and progressive nature. The participants with spouses were also evaluated for this study. Chronic arthritis takes a toll on couples because the healthy spouse helps their partner with everyday activities. Some of the participants described how their spouse had to help them with getting dressed, with household work, and managing their children. The participants felt an overwhelming amount of guilt and burden because of how much help they needed due to their disease. Arthritis can emotionally affect those suffering because it brutally affects their quality of life. Those affected may feel guilty for how much help they need from the people around them. They also feel inadequate because they are not able to take care of themselves like they used to. As the disease progresses, they will eventually need more and more help and essentially feel like a burden in the end. Since arthritis is an umbrella term, we will discuss the two main types of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is characterized by progressive damage to the bone and cartilage. It also causes dysregulation of synovial function. Osteoarthritis usually arises from damage of the articular cartilage due to wear and tear, usually prompted by a physical injury. It is also influenced by underlying factors such as genetics, cellular, and immunologic reasons. There are also signs of inflammation in the synovial membrane that accompanies osteoarthritis. The meniscus and the cartilage become extremely worn and they are slowly deteriorated, causing the bones to rub together. Over time, these signs and symptoms progress to such a degree that the damage makes it difficult to carry out everyday activities. Rheumatoid arthritis is also a progressive, destructive joint disease with an unknown etiology. It causes chronic inflammation extended from an invasive synovial membrane. Rheumatoid arthritis is caused when semi-transformed cell types in the synovial membrane add to the expansion and advancement of secreted pro-inflammatory cytokines and tissue-degrading proteases. These semi-transformed cell types can be either monocytes, osteoclasts, T and B cells, or synovial fibroblasts. Rheumatoid arthritis causes the cartilage and meniscus to become extremely worn out that the bone starts to rub against each other. This friction causes severe damage and destruction to the bones and unbearable pain. Osteoarthritis and rheumatoid arthritis have different pathogenesis, but they exhibit very similar observed symptoms and overlapping cellular and molecular characteristics. For the sake of this presentation, we will be going into detail about the different kinds of arthritis, but mainly be covering arthritis as a whole.
Rehabilitation and article review. A secondary disability is defined as the physical or mental condition that is a result of a prior condition. Secondary disabilities associated with arthritis include hearing loss, vision issues, social and functional limitations, and psychological issues. Psychological issues, specifically depression, are a common secondary disability found in arthritis patients. A 2006 study found that there is a higher prevalence of serious psychological distress and frequent anxiety or depression in those with arthritis. The study found that psychological distress was associated with test subjects' age, socioeconomic status, relationship status, recurrent pain, physical inactivity, experiencing one or more comorbid conditions, and having social or functional limitations. Additionally, the Arthritis Foundation states that approximately 40% of arthritis patients experience symptoms of depression. A rehabilitation strategy that addresses the secondary disability of psychological issues, particularly depression, in arthritic patients is Tai Chi. Tai Chi is an ancient Chinese exercise used to promote mental and physical health. There are several styles and forms of Tai Chi, the main ones being Chen, Yang, Wu, and Sun. And while they are all different, they all include the same baseline principles. The baseline principles of Tai Chi include mind integrated with the body, control of body movements and breathing, mindfulness and the creation of internal energy, Song, loosening, as well as Jing, serenity. The main purpose of Tai Chi is to grow internal Qi, or life energy, so that it can flow throughout the body smoothly and powerfully. Tai Chi has been shown to improve mental health, increase strength and flexibility, improve quality of life, relieve pain, and increase fitness. A 2009 randomized controlled trial by Wang et al. Studied the effects of Tai Chi on treating arthritis, specifically osteoarthritis of the knee. To begin, the study was a 12-week randomized controlled study, and the subjects were followed up both 24 and 48 weeks later in order for the effectiveness of Tai Chi being used as a rehabilitative therapy to be evaluated. The study sought to review the effectiveness of Tai Chi on pain, functional independence, and quality of life as it relates to health mediated by muscle function, flexibility, and mental health. Between October 2005 and February 2006, 366 individuals were screened by telephone, and 40 were found to be eligible to participate in the study. The participants partook in either a Tai Chi intervention or an intention control intervention of wellness education. The Tai Chi intervention involved bi-weekly instructed classes on classic Yang-style Tai Chi for 12 weeks. Every Tai Chi session included a 10-minute self-massage and a review of Tai Chi principles, Tai Chi movement for 30 minutes, breathing technique for 10 minutes, and relaxation for 10 minutes. Subjects also received a 20-minute Tai Chi DVD that they were instructed to use at home. The attention control group, which consisted of wellness education, included bi-weekly, hour-long classes for 12 weeks, and consisted of 40-minute lessons on osteoarthritis, diet and nutrition, osteoarthritis therapies, and education on physical and mental health, as well as 20 minutes of stretching exercises. Subjects in the control group were also encouraged to practice the stretching exercises at home for 20 minutes a day. The participants had a mean age of 65 years and were mainly women and white, and had knee pain for 10 years, as well as a BMI of 30 kilograms per meter squared. Attendance was 85% for the Tai Chi group and 89% for the control group, and no patients withdrew from the study. However, monetary compensation was offered in order to increase and maximize participation. At the 48-week follow-up, 45% of Tai Chi subjects continued with the practice, while 40% of the control group continued practicing stretching exercises. The primary outcome of the study was a reduction of pain in the Tai Chi subjects, which was analyzed using the Western Ontario and McMaster University's Osteoarthritis Index, or WOMAC, pain scale, which was statistically significant at the 24-week follow-up, but not statistically significant at the 48-week follow-up. Subjects of the Tai Chi group showed improvements in physical function and stiffness. However, findings were not statistically significant, and changes in BMI and balance were found to be insignificant. Additionally, the Tai Chi group had statistically significant improvements in self-efficacy and depression at both 24 and 48 weeks. Overall, the Tai Chi was found to be efficient in order to reduce pain, improve physical functioning, depression, and self-efficacy in patients with osteoarthritis of the knee. Furthermore, the study had several limitations. The first being that the attention control group appeared to have more severe osteoarthritis of the knee, which was likely due to the small sample size as opposed to the randomization procedures. Another limitation was that the treatment patients were receiving could not be masked, and patient bias and belief may have affected outcomes. However, the baseline of expectations of benefits was found to be similar in both the Tai Chi group and the control group. The study was also evaluated using the Pedro scale. Number 1. Eligibility criteria were specified. In order to be eligible, patients had to be greater than 55 years, have a body mass index less than 40 kilograms per meter squared, a WOMAC pain scale score greater than 40, and fulfill the criteria for osteoarthritis of the knee as laid out by the American College of Rheumatology with a radiographic Kellgren-Lawrence scale grade greater than 2. Number 2. Random allocation of subjects. 40 subjects were randomly assigned by a statistician using computer-generated numbers to either the Tai Chi intervention or an attention control group. Number 3. Allocation was concealed using sealed opaque envelopes so that patients may agree to participate. Number 4. Similar group baselines. Block size was used to minimize the correct predictions of assigned intervention and to maintain similar group baselines. Number 5. Subjects could not be blinded. Number 6. Blinding of therapists was not mentioned. Number 7. Blinding of assessors. Assessors were blinded, but there was a possibility of information being leaked, as subjects may have informed assessors of their treatment. However, leaked information was not reported. Number 8. At least 85% of subjects reporting a key outcome was not mentioned. Number 9. Data was analyzed on an intent-to-treat basis, and subjects received either the control or the Tai Chi treatment. Number 10. Results of between-group statistical comparisons were reported. Number 11. Point measure and measure of variability for at least one key outcome were not mentioned. While the study does show a link between Tai Chi and depressive symptoms in those with arthritis, specifically osteoarthritis of the knee, there are several limitations beside the ones listed in the study. To begin, the sample size was small at 40 subjects. A larger sample size may have better supported the effects Tai Chi had on subjects with osteoarthritis of the knee, as it would have shown a greater diversity between the experimental therapy and the control. A third critique is that the study was only carried out for approximately a year. Subjects participated in the control or the experimental therapy for 12 weeks, and there were 24 and 48-week follow-ups. Depression can be both chronic or acute, so a long-term study greater than a year may have better shown the link between Tai Chi and depression. Lastly, the effect of Tai Chi on depressive symptoms was listed only as a secondary outcome. In the study, there were notable statistically significant improvements for depression and self-efficacy at both 24 and 48 weeks. While the study does show that Tai Chi is effective for treating depression, based on the statistical evidence, the study did not primarily focus on depressive symptoms. If the study had focused on depressive symptoms primarily, there could be better evidence to support the connection between depression, arthritis, and Tai Chi. Additionally, the study also showed that Tai Chi may be effective in treating other symptoms of arthritis, such as pain and increased physical functioning. In conclusion, this study by Wang et al. Provides some evidence that Tai Chi is effective in treating depressive symptoms in adults with arthritis. Further study is needed in order to better support the hypothesis. However, there are a number of other studies that have shown the link between Tai Chi and depression, or the link between Tai Chi, depression, and arthritis. Due to this study and the number of other studies and reviews evaluating the link between Tai Chi and depression, or Tai Chi, depression, and arthritis, I believe that it is fair to say that Tai Chi may be used to effectively treat depressive symptoms in adults with arthritis. Other studies that have shown the link between Tai Chi and depression include a study which was submitted as a supplement by Srinivasan et al., a qualitative study by Waite Jones, Hale and Lee, a systematic review and meta-analysis by F. Wang et al., a second by Chang, Chen, Lee, Lin, and Lai, and a third by Chen, Hunt, Campbell, Peel, and Reed. In conclusion, while arthritis is a chronic and sometimes debilitating condition, it is possible to manage a condition and live cohesively with it. Thank you for listening to our presentation on arthritis. Here are our references.